it's probably very important that we work interdisciplinary, because otherwise we don't get enough knowledge about affective neuroscience, about fear, because I will talk about fear today. So we need such events, and we need biologists. So thanks. Today I will talk about how can we use the knowledge from neuroscience in psychotherapy. These are two fields that seem not to somehow belong together, but I will try to show you that they belong together. You can learn from you as neuroscientists, can learn from psychotherapists, and psychotherapists can get the knowledge about psychotherapy and about the mechanisms of the development and maintenance and the therapy, especially here of anxiety disorders. I will show you a little bit about what I will talk today about. The first point is, we psychotherapists sometimes feel like witch doctors, because actually we know, we try to do things and discover things, but we don't know what we are doing actually when we do psychotherapy. We try, we make some investigations, we build some theories, but still we don't know what is going on here. So it's like a little bit like witch medicine, still psychotherapy, but it will change hopefully. The second point I will talk about, these are neuronal mechanisms of anxiety disorders, and especially I will concentrate on the role of attention in the development and maintenance and therapy of anxiety disorders, and then I will move on to the risk of fear system sensitization in the therapy and the risk of fear conditioning in therapy. And then I will talk a little bit about what's actually most important in the therapy, how to build new associations, how to learn our patients something new about fear events, about fear situations. So let's start with a short interview. You will get a feeling what I'm talking about when I talk about witch medicine. Wait a minute.
What is it, 15 years?
Can you do it a little bit?
13 years in classical Freudian psychoanalysis. Talking to Woody Allen, we were sort of segueing into the subject of, what is it, 15 years?
No, 13.
13 years in classical Freudian psychoanalysis.
Yes, 8 years I was on the couch, and 5 years I was allowed to sit up and face him and chat, and it helped me, I think. I don't know.
How do you know, really? That's what it's always the big question mark for me, is when do you decide, I'm done?
That's a good point. I don't know if you're ever really done. I know that certain characteristics about me are different now than they were when I started analysis. I started when I was 22, and I'm 35. So I have aged. That's something.
That is progress, because
yes.
it's upward.
Yes.
Yeah.
And I can, when I have sexual relations with someone, I can now think of that person rather than somebody else, which is an enormous step forward to me.
How many years did that take? Where did that come in?
That just came in last week.
Can you give any pointers to that thing people always want the answer to, is how do you decide who's the right analyst for you? Did you dismiss or interview any and then reject them?
Not me, because I always have blind faith in doctors. You know what I mean? They could do anything they want to me, and I wouldn't know the difference. If a guy's a doctor, I go in and whatever he says is okay with me. You know, I have no expertise, medical expertise at all. So, whatever they say is fine, and I always accept the first of anything. Because that's true in all walks with me. When I go to buy a jacket, I buy the first sport jacket, the first automobile, the first, I don't have the patience or the curiosity to find out anything.
And you figure the guy knows what he's talking about, even though it isn't necessarily true.
Yes, until he was arrested.
Yes.
Then I began to suspect something.
Did you have you had two analysts and you switch in midstream?
I switched after 8 years. I had one for 8 years, and I just used to lay there and talk, and nothing really happened except, that was it.
So how did you decide to switch then? Isn't it dangerous to switch?
Why not switch?
Yeah, it's true.
You know what I mean?
It's another way of looking at it.
If nothing's happening, I have nothing to lose by switching. So I switched, and now nothing's happening over 5 years.
But at least it's a different person.
Yes.
Would you ever let a woman psychoanalyze you?
I would, but I think I'd feel shy to tell her
Yeah.
the real innermost workings of my erotic desires.
And how do you then? Because that's part of what you have to do in psychoanalysis, and there are women psychoanalysts.
Right, I don't know if I could do it. I don't think I could be checked by a woman MD in general. If I...
Okay. So you probably have a feeling about what patients feel when they come to psychotherapists. Which one? Okay. But imagine sometimes we feel the same as psychotherapists. Sometimes we do not know what we are doing. We build hypotheses about what we want to do and what is going on in the brain of our patient. But these are only hypotheses. Therapy is something like trying new hypotheses, whether they work. I don't want to belittle psychotherapists and psychoanalysis, but still, this is a field where you have a lot of personality theories, for example, and which personality theory you can choose to work with patient. We want to know about these mechanisms, I think, until we don't look at neurobiological mechanism of what is going on. This is very complicated because the brain is very complicated, and the psychological disorders are very complicated. So it won't be easy. That's why I will start with simple phobias, because they are simple, even though they are not very simple in neuroscientific language. But I will show you now a little bit more about what we know, how simple phobias develop, and how we can treat simple phobias. Okay. This is like psychotherapy. You are doing something, and then 2, 3, 5 weeks later, it's working. So, no, this is not working. Okay? Okay. So, the role of attention in the development and in the therapy of anxiety disorders. Because, I wanted to look at the attentional process. I used EEG in my studies, and we will today probably 90% of the data I will show you, these are EEG data. The first experiment I made was experiment on spider-phobic subjects and non-spider-phobic controls, and I just used a very simple paradigm. I showed them some pictures. These were, as you see here, pleasant pictures, neutral pictures like buildings or landscapes, and then unpleasant pictures like mutilation or mutilated bodies or human-animal threat, and surely spider pictures. They were shown in a stream. Each picture was shown for 1,500 milliseconds, and we will see. It looks like this. And then we measured EEG, and as you know probably, we averaged the EEG waves and got the ERPs, event-related potentials. And what about attention and spider phobics? This is the first component I will talk about. This is so-called early posterior negativity. You see it here occipitally, or sometimes also a little bit temporally. And as you can see, yeah. Okay. It was just closed. So as you can see here, look just for spiders. Spider phobics are thick and controls are thin. You can see here the difference between spider phobics and controls, starting about 200 milliseconds. So the spider phobics showed greater early posterior negativity than controls, and it was observed the difference between spider phobics and controls. The great difference was here. And it speaks for selective attention. Already it's 200 milliseconds after the onset. The onset is 0. After the onset of the picture, there were no differences, no significant differences in this time window for neutral, pleasant, and unpleasant pictures. So they seem to selectively attend to spiders, and this. Later on in the processing stream, you can see it on the component called late positive potentials. This is here, as you see at the ERP wave after the occurrence of spiders. You can see that spider phobics thick and controls thin. You can see that spider phobics show greater late positive potentials. It means that they recognize the stimulus. This is already, it starts to be conscious at this moment. They recognize the stimulus and they start to evaluate spider pictures. So they continue what they started during the early posterior negativity. They continue here. So they just elaborate. This speaks for elaborated processing of spider pictures. And there were no differences for other pictures. You might see a difference in another direction actually, but it was not significant. But it's not like something strange. You can imagine that they just put more attentional resources to spider pictures, and then they don't need these resources for neutral pictures, for example. Okay, so the point is, this late positive potential, when you see here the mean for late positive potential, and left you can see spider phobics. These are spiders. So the LPP for spiders was similar to the LPP for unpleasant and pleasant pictures. So it is not that the selective attention, increased selective attention, is fear specific. It is emotionally specific. There are some researchers who claim that the attentional bias to feared stimuli plays a really great main role in the development and in the maintenance of anxiety disorders. And I can't imagine that it's true, because otherwise you would get also a phobia for pleasant stimuli, fear response for pleasant stimuli, for example. So it does not look like attentional bias plays an important role in driving our emotions. this is probably another way round.